Thank you. And before starting, or as we start, I'm going to hand over to Jamie Medicine Crane.
Okinik Sokwa, Idamis Ganatani, Nistuna Danako Axia Suaki. Hello, all my relations. My name is Jamie Medicine Crane, and I come from Southern Alberta, and it's such an honor to be here with all of you in such an important and overdue conference that we need to address for our youth and our adolescents. I would like to acknowledge the traditional unceded territory of the Algonquin people and the ancestors that stood here before us that allow us to be here to have this very important meeting. I would like to start this session with an honor song to honor the land that we are on, to honor the food that we just had and all of the nourishments that we get throughout the week, but also to thank Creator for the land we walk on, the water we drink, the food we eat, and also for all of us to be able to come together to have this safe space to share so many important messages. This is also for you and your family. If you are going through any loss in your family, or people just need any extra prayers, this honor song is for all of you. Thank you.
Thank you, Jamie, for honoring this session. And I hope that in this we're actually honoring the adolescent girls in the world as well, and bringing them into the room with us as we have this important session on the sexual and reproductive health and rights of adolescent girls. Jamie is actually my boss. You might not know that. She's on the board of the World YWCA, and she has a master's in education and leadership administration, and she's a teacher by profession, an artist, an activist, an entrepreneur, and she specializes in Indigenous, First Nations, Métis, Inuit education. She's the founder of the Nitsipati. Did I get that? Okay. Dreams, the Blackfoot term meaning the real people, a holistic school designed to build girls' self-esteem and leadership skills. So welcome, Jamie. And I'd like to invite the other two panelists also, starting with Dr. Yadna from Myanmar, who's a passionate advocate for sexual and reproductive health and rights of young women. She holds a medical degree, and she's the co-founder of Nimale organization, which promotes young women's access to SRHR knowledge. She's worked to empower young women, also in the ethnic minority communities in Myanmar and young key populations, by equipping them to be agents of change in their communities. And her dream is to be part of the health sector reform in Myanmar and the policy making that can really change the state of play on SRHR. So thank you very much for joining us. And last, certainly not least, is Mitsungi Kachingwe, right, who is a medical doctor. She serves as the board president of the YWCA in Malawi. So it's really young women's leadership in action, and she's passionate about sexual and reproductive health and rights, and she serves as a mentor for young women and girls, working with chiefs to ban early marriage and return girls to their home or the school system who have been in forced marriages. And she has real insights into adolescent pregnancy, contraception, and the issues of child marriage in Malawi. So thank you very much. It's really my honor to facilitate this session today with leaders in the field who I think will be able to share with us the experiences and the challenges really facing adolescent girls in the communities. And then we'll go on and we'll move on to talk about the innovations that we think are needed, that we can bring to scale to actually change the status. But first I want to start to taking us back 23 years. To when I was an adolescent. No, actually, that's wishful thinking. But to 23 years, to when the landmark ICPD declaration and agreement took place. And in many respects, it was landmark in relation to adolescent sexual and reproductive health and rights, though the focus at that time was largely on unmarried adolescents. And there was some limitations in terms of understanding of the responses that needed, but nonetheless, it was firmly on the agenda, these issues. And I think it started a ball rolling. Although there was limited understanding of the responses 23 years ago, that's not the case now. So many countries now have sound national policies, and we have a much greater understanding, as we heard earlier today, on things that work, but they remain as pilot projects and are often kind of being rolled out in the face of massive resistance. And at the same time, we continue to scale up approaches that don't work, right? Or we scale up approaches that work, but we scale it up badly. And the consequences are actually catastrophic of that way of working. There's two things that I think we all share in this room that brings us here today. One, we are deeply human. And with that comes the rights which are universal to all women, men, children, and everyone, regardless of race, religion, ethnicity, sexual orientation. And the second, I assume that there's no Dolly the sheeps in the room, but the second is we're all a product of sex in one way or another. And yet, despite this, we all know, and particularly in recent months, from the boardroom to the bedroom, from communities to the hallowed or the not so hallowed halls of the United Nations, to 6 white men sitting in the Oval Office on the 23rd of January signing an executive order that signed away the rights to our body, there's a continual and sometimes unrelenting attempt to control our bodies. And this plays out, yes, for all women around the world and all sexual minorities around the world, but nowhere is this more true than in adolescent sexual and reproductive health and rights. And that's why conferences like this, at this particular time in history, are so important. And we know that there's some reasons for this, and one is that the issue, there's deep discomfort on the issue among community leaders, among parents, among cultural leaders, and there's inadequate commitment. I don't know which session it was earlier today, but inadequate commitment to really transform the power structures, not so much the inadequate commitment around the financing and the solutions and the rolling them out, but to transform the power structures that allow this to continue. And there's no real accountability, and that's why I love the session that came earlier to this around the frameworks that we have. And the consequences we know. 15 million girls are married every year before the age of 18, and these girls are deemed old enough to marry, but too young to access contraception. Right? 16 million girls aged 15 to 19 give birth every year, and 50% of these pregnancies are unintended. 1 million of these pregnancies happen among girls under the age of 15. And every year, there's some 3 million girls aged 15 to 19 who undergo unsafe abortion. So this isn't to frame things as hopelessness, because I don't think we're in an era of hopelessness. I think this is about framing things not around what we're against, but what we're making a commitment to. And that's why I loved the Women's March around the world on the 21st of January and the She Decides conference and the phenomenal commitment that the Government of Canada made on the 8th of March. And her voice, her voice, her choice. I saw the banners outside. And most importantly, why it's important that we're hearing from the frontline strategists and leaders and activists, young women in the communities who can tell us actually what the barriers are and how we can change things. So with those introductory words, I really want to turn to the panel, and the focus of this panel is around how do we reach those adolescent girls who are the most left behind, those who face the multiple and intersecting forms of discrimination. And so, Yedna, I'm going to start with you. We know and we watch the news that there's exciting change happening right now in Myanmar, and it's generally seen as a time of rapid change where lots of things might be possible that weren't seen as possible before. Can you tell us a little bit about the dominant approaches to sexual and reproductive health and rights, and whether these are responding to the needs of adolescent girls in Myanmar?
Thank you. So in 2010, we had the election, and then we had the very first democratic government, but it was not really a very democratic government. And it was in 2010. And then in 2015, we got the census, and the results are that the maternal mortality ratio is 282, which is very high. And then the maternal mortality ratio for adolescent girl between the 15 to 19 years old is 262, which is very, very high in the region. And when we go back to the commitment from the government, the health budget of the government is 3.65%, which is very low. So what are we doing? So the approaches, the dominant approaches we are using, I want to divide it into two. One is services, and one is the information. For the services, we have youth-friendly services, but the youth-friendly services are mainly operated by the non-governmental organization. So in reality, they are present in urban and suburban area, but not really in the conflict area and the hard-to-reach area. And they're targeted towards young adults rather than the adolescent girls. So the gap here is that we need to upscale the youth-friendly services. So the context of Myanmar is that there's been decades of inter-ethnic conflict happening. It's like 50 years now. So the majority of the ethnic majority is Myanmar Burmese, and then there are 7 ethnic minority. So the major and minor are fighting. So there are many refugee camps, and there are many systematic gender-based violence and systematic rapes committed by the Burmese army to us, the ethnic minority. So at this refugee camp area, there's very few youth-friendly services for the adolescent girls. So this is for the services. And for the education and information, we had the sex education, but the sex education focused mainly on reproduction and biology. And it is introduced in the high school, which is like adolescent girls already past their pubertal changes. And what's funny is that the reproduction, it's between frogs and rabbits and not even between human. Yeah. So, and also it focuses on the heterosexual relationship rather than the inclusiveness of the sexual orientation and gender identity, and also about the gender and power. So we have the services, we have the information, but many adolescent girls, especially the vulnerable adolescent girls, are left behind in this situation.
Thanks very much. Oh, I don't know if this, oh, there it is. Thanks very much. So if I understand, correctly, there's the marginalization of the ethnic minorities and there's the conflict, and they're not being reached at all.
Yeah.
There's a situation where the programs are deemed for adults or young adults, but not for adolescents, so they're not appropriate. And then we have on top of that kind of poor quality comprehensive sexuality education being rolled out piecemeal by NGOs and not going up to scale.
Yeah.
Thank you very much. Jamie, I want to turn to you because there's a slight similarity in some ways in the context. This year, somebody mentioned earlier today, Canada is celebrating its 150 years as a nation and has made incredible progress in that period of time on adolescent health and sexual and reproductive health and rights, and in many aspects is considered a leader in this area. But we know that there's many adolescent girls who are still left behind. And as a leader from the First Nations community in Canada and an advocate, can you describe your experiences and the realities for Indigenous adolescent girls and how and why they've been left behind in this period?
That's a good question. I think that for me, since the beginning of colonization, Indigenous women and girls have been taken advantage of. We say that we're having 150 years of celebration of this country, but our people have been here way longer than that. I know that elders have told me stories that we're here longer than 150 years, and we've been here longer than the pyramids and longer than Stonehenge, and there's stories about our people walking with the dinosaurs. And so when I look at the history of this country, I see a lot of colonization that has happened over the years and has disintegrated some of our values and our traditional knowledge. Indigenous peoples' marginalization is a result of historic oppression, including the land and traditional knowledge. For myself, I don't feel safe in this country. To walk down the street by myself, it's a reality for many of our girls. I'm wearing this shirt honoring our sisters because there are over 2,000 murdered and missing Indigenous women and girls in this country. And we have our current government said that they were going to do an inquiry to murdered and missing Indigenous women. And currently, they're supposed to be interviewing thousands of families and people that have been victims to violence. And we have to wait till the fall time now. And the report is due November 1st. So how legitimate is that process? I feel that Indigenous girls confront considerable obstacles to the realization of their human rights worldwide. Nationally, we face disparities in nearly every measure of human development, from income to health to education, but their rights are insufficiently acknowledged, and mainstream development paradigms. Entire Indigenous cultures are under threat from a range of social and environmental factors, from climate change, land degradation, to loss of traditional lands and territories, the knowledge, our resources, our languages, and practices. Despite these challenges, Indigenous knowledge and historical development concepts are key to addressing of interlinked development priorities, from tackling poverty to improving maternal health to ensuring environmental sustainability. I feel that if we are going to move forward with the sustainable goals, we need to start acknowledging what's happening in our own backyard, what's happening in this country of Canada that we see as a peacekeeping country around the globe. And we need to start addressing those so that our girls are not left behind. Thank you.
Very much. Thank you very much, and there's absolutely nothing I can add to that intervention. I want to turn, Mitsungi, to yourself. We know that in Malawi, the average age for an adolescent, somebody to have their first child is the age of 17, and that a quarter of the population in Malawi is adolescent. Yet, we also know that there's been some great change in Malawi, and that recently there's been great leadership around ending child marriage. Now, you used to work in a rural hospital in Malawi and interacted with young women and adolescent girls who were forced into early marriage or had unintended pregnancies. Can you share with us the reality and the key challenge affecting adolescent girls accessing sexual and reproductive health, and how we can change this?
All right, thank you. I think, not to take it away, Malawi has made excellent strides. I mean, the commitment is there. We have made efforts to reduce the numbers, but we still have a long way to go. I mean, if I were to write down all the policies and strategies, this banner wouldn't even be enough for me to write how many policies and strategies have been created in Malawi towards adolescent health. But it raises the question, why are we still very far behind? Till today, I mean, we've heard different statistics, but as of now, there's still a very high unmet need for contraceptive use amongst adolescents. There's still a high rate of teenage pregnancies. There's still high rates of young people getting into marriages. There's a very high rate of teenage or school dropouts, and this goes across more amongst females, but also with boys as well. And this also has to do with a big margin in terms of how we have approached our interventions, okay? We've taken them in a sort of, you can imagine from a pragmatic point of view, you take a public health approach where you want to reach the most people as possible. But with that, what we've done is we've left some key populations behind. For example, the married girls. Understanding the setup, you will not be able to remove each and every girl from a marriage, whether she's 15 or 16. Sometimes in the context, it's an informed decision. Okay, so we need to be able to reach them and help them in that context. We cannot take this one-size-fits-all in terms of coming as though we have the better knowledge. It's about understanding the context and creating the best outcomes in those contexts with that approach and being adaptive to things. Single adolescent mothers, what are we doing for these young women? She's gotten pregnant. The husband or boyfriend has left. She's a single mother. She may or may have an extended family, but sometimes how are we helping them? What social programs, and not on the NGO community as well, but for government, what are we doing for them? Those that are out of school, we're always talking about comprehensive sexuality education. Where are we giving this education, all right? Not everybody is going to school. We're still struggling with universal access to primary education, even though it's increased. The numbers continue to go down. I mean, the numbers that will get in primary school, if they're lucky enough to finish, the numbers will be less for secondary education. If they are lucky to finish, the numbers will even be much more less for university education. And even if you do finish university education, the numbers actually finding employment is even much more less. Right? So we need to be able to think, where are we giving this information? Or how best can we provide this information and be able to be adaptive? We have the orphan community, very poor. There are those that it's children running a household. They're all alone. We have high rates of HIV in our country. And we even have adolescent sex workers. Those are key populations that we're not doing enough to target. We're not doing enough to protect in terms of their sexual reproductive health and rights. Okay. We've spoken about comprehensive sexuality, poverty as well. That's a key challenge to our programs. From Malawi, if you look at our demographic health survey from the last one, which was in 2010 and 2015, there's a slight increase in the number of teenage pregnancies. And that's not something that people expected. But we then have to think about our programs in terms of the social determinants of health. They're very different things. And if we think about adolescents, we're defining it from the age of 10 to 19. That's a very big spectrum. So as much as you may have a program for 5 years, that's from 10 to 15 years of age. What happens from 15 to 19? Things could change there. So it's about creating lasting, sustainable programs. And then we need to talk about the access to services. Where are these services? I come from a country where services are very far. So even if you say we have a youth-friendly health services profile, how are they going to be able to get it? Because if they go to school, then home, and then everything, it's quite challenging. I mean, when it comes to contraceptives, you can understand the rationale of how this was done. The health centers would drive out into the communities. You find whatever is there, whether it's a tent, a school, and you'll have women lining up. And it's mostly women with kids on their back. So for you to have easy access to contraceptive, you already have to have a baby. Because if you're single and just a young person enjoying that line, it's a very long line, probably to fill this corridor. And as a health professional, I've actually done one. A young person's not going to come. So we've been able to reduce how people access contraceptive, but we haven't been able to reach that population. I think I'll stop there for now.
Thank you. I said this wasn't about hopelessness. So I want to turn now to some of the great innovations and opportunities that we might have. And there's many more than on this panel. There's tons in this room that we've heard about today. But the challenges we've heard at the first set of questions really had a lot to do with the dominant approach, the lack of support from communities, and some of the problems with blanket approaches, the one-size-fits-all, even for adolescents, will actually miss the most vulnerable adolescents. And all three panelists talked about just the fundamental problem of access. The services just aren't there, or they're localized in urban areas and delivered in urban areas. So, Yadana, you mentioned about the poor quality comprehensive sexuality education, and that the most marginalized communities couldn't even get access to basic information at all. Can you share with us the innovations that you're looking at in Myanmar that would address those barriers?
Yeah. So our organization is called Nyimale. Nyimale in Burmese language is a little sister. So the approach we take is like the big sister, which is a young adult, talking to an adolescent, which is a little sister. And we believe that knowledge is power, information is power. So we produce a series of comic book, and we frame the comic book around the older sister, giving information about the sexual and reproductive health and rights to the younger sister. So it's about like menstruation, it's about contraceptive, it's about the sexual and reproductive rights. And then these comic books are designed together with the young women. And another thing we are designing is automated interactive robots. So now it is very popular in social media, especially Facebook, used mainly by the businesses to attract the customer. And if you don't know it is a robot, you can't tell it is a robot because the interaction, it is very active. So what we're designing is we are designing a robot of a big sister where adolescent girl or young women can come and chat and have information about all the sexual and reproductive health and rights. And then we link with a website where a help person is there 24/7 answering the question. So if they need more information than a robot can provide, they will be linked to that service. Yeah. But I understand that this is the knowledge part, and we also have to tackle the attitude and the practice to have an impact. So for the attitude, we need to change not only the attitude of the adolescent, but also the surrounding environment. So we need to change the attitude of the parents and the teacher and the society. Who are actually the main actors who prohibited adolescent girls from accessing the information and from accessing the services? So we need to develop a program to change the attitude of the surrounding environment. Let's think about it like, what if your surrounding environment is so judgmental about you going to the sexual and reproductive health services? Though the services are there, adolescent girls won't go there because there's so many pressure around her. So if we want to improve the access, we need to change the surrounding environment attitude also. And also for the practice, I mentioned that youth-friendly services are developed mainly by the non-governmental organization. So the innovative strategy is that we need to develop youth-friendly services, yes, but another way we need to do is we need to make the existing services youth-friendly. In that way, we can reach out across the country because health services are set up by the government everywhere. So if we can make the health services youth-friendly, then we can reach out to marginalized young women and adolescent girls.
I think that's beautiful because, in fact, the innovation isn't an innovation. It's about making the health system work for everybody and rolling things out through the health system, as well as providing that innovative information that young people can access on their own. But all of it, I think, and we saw this in Malawi with the youth-friendly services, all of it is impossible if the community leaders and the parents aren't on board for this way of working, and that's a much deeper program. Jamie, the reality you described is huge, and the change that's required is huge, and it gets really to the heart of power in communities. And what you described was multiple generations and the impact of this over multiple generations. So I want to challenge you a bit to ask what can be practically done to improve the context of Indigenous adolescent girls around the issues of violence and adolescent pregnancy and access to services, given the complexity and the depth of the existing situation.
I think when we excuse me, are we on? Okay. I think that when we look at the services in regards to Indigenous girls, I really think about that these girls need to be at the table when we're making decisions about them. They need to have their voices heard. And also we need to look at the cultural protocols that go around it. I think that appropriate health models and services with full participation from the Indigenous girls is very important, especially in the design of how the program is created. And this may increase a higher degree of satisfaction with the adolescent-friendly services. But for myself, I really see a holistic approach to SRHR because for me, I think in a holistic way, so that means that we're not working in silos, that health is not just in one piece. It's your entire being. When we look at a human being, we look at our emotional, mental, physical, and spiritual self, and that's what makes up our whole being. And in order for us to start working with our girls, I think that we need to try to start thinking that way instead of thinking so linear. As well, I think that in order to improve the relationship, like Canada is working towards reconciliation, I think that we need to start working together, start understanding the true history of this country, to know that our Indigenous girls have always been left behind when it comes to services like this. Like we weren't allowed to vote until almost 50 years after the general population was allowed to vote in this country, and we've been here longer. And I guess one of the best quotes that I got from my elder that has passed on, the late Narcissus Blood, he's also my relative, but it's be wisely aware of your surroundings. Know where you are and know who you're working with, and really build those relationships. I think that that's the key in order to building any service for our population and our society, is knowing who you're working with and allowing them to have that voice at the table. I think that that's really important.
Thank you very much. Ms. Sunge, you also described a context where power was essentially at the heart of it, and traditional and cultural norms that denied young women control over the right of whom they married, when they married, and also the context of poverty, very complex. But I know that you've also been working on some transformational and innovative approaches in Malawi. Can you share them with us?
I think the important thing that I think moving forward is we need to remember we're not starting from scratch. Yes, we're not where we used to be, but we have done enough to point us in the right direction. Most of the things, it's about scaling up and continuing to understand the context that we work in. I come from Malawi, and a very strong belief is it takes a community to raise a child. Okay, I was raised by a community, it's how it works. So if we're talking about giving information, the important thing that I learned, or through our program that we learned, and think some of us have been doing, is the parents, religious leaders, traditional leaders. I know we mostly get buggered up in between comprehensive sexuality education and resistance, but it's about opening the channels, okay? In the earlier session about comprehensive sexuality education, it was actually stressed that, yes, the word comprehensive is important to us, but it's about how you approach it. Because sometimes if you go in with the safe topics, you'll end up finding that you've been able to discuss all the topics. Because I remember we once had a dialogue with religious leaders, and we were talking about the usual safe topics. And one guy actually raises up his hands to say, okay, I've had people coming up to me saying he has erectile dysfunction. And then the conversation changed, and you actually see that in the community themselves, they're afraid to talk to each other. They want to be able to talk to each other. The things of adolescents, where are they getting the information? Not everybody's going to school. We've already heard how schools are doing, or teachers are struggling to give that information. If I look back to my own growing up, most of the information I got was really from my peers. This is before medical school. But the one conversation that I actually had with my parents, for example, periods. I started my periods very early. And it was because it was at night, all of a sudden you wake up, your bed is a mess, you go and wake up your mom. And in those 10 minutes, that's the first and last time we ever spoke about it. The rest was with your friends. This is if you're having cramps, or it's just going on too long, etc. But if I'm coming from a more privileged than my peers in the community, can you imagine the lack of information that's going on there? So what are we doing? I know peer education programs have difference, but it's about how you approach it. Because if you actually have a few people that are saying the right information, you'll be amazed at the transformation that you can make. And it's about scaling up these programs. It's about linking the youth to these services. I've already mentioned the services are far, etc. And the important thing I'd like to stress is about a holistic approach. I know as NGOs, programs, it's program design, it makes it very complicated. But if you want to make the most impact, you really have to think about it. Because I'll give an example, Malawi, maternal mortality. We've done well. We've managed to bring it from 657 to 437. But this is when people are beginning to realize that we've done so well to make sure that women get to the hospitals. But the hospitals were not prepared for the women. That what we've done significant is to change where women die, from the community to the hospitals. So we need to be able to have this dynamic and to be able to relate to these circumstances. Economic empowerment, okay, I've said they're different populations. I've actually had one girl talk to me. She was a peer educator and she was being beaten up. And she said, okay, you think about the approach of advising of our rights. And then she says, I know that, but that's not going to put food on the table for my child and I. So it's about actually tackling those things and how well we're linking with the partnerships and services. But even the partnership themselves, we need to realize that we also sometimes can be part of the problem. We get bogged up in policies and we design or we pick what we think we can do. And that can be a challenge, and we can also be hindering adolescent health. I think I'll stop there.
We have only a few minutes left, but I wanted to be able to take 2 questions, perhaps from the floor, if anyone had questions, and if not, we'll wrap up. Please.
Hi, my name is Samuel. I'm with Doctors of the World Canada. I wanted to tackle the issue of access, which was brought by the panel. I myself had a lot of success working with community health workers in Africa for more simple morbidities such as malaria, but I was wondering if this is a concept that could be used to provide SRHR services and family planning to adolescents in faraway communities. Thank you.
Okay, is there another question as well? And also, I think because the speaker's faced that way, it's actually very hard to hear the questions. And so it sounded a bit muffled, but we'll do our best on that one. Please.
Hi, my name is Ashley Vandermorris. I'm an adolescent medicine physician at Sick Kids in Toronto. I wanted to ask you to sort of give your thoughts on this tension between scaling up and being sensitive to the unique experiences of different groups. And you sort of alluded to this sort of tendency to get caught up in our own policies. And I think we heard earlier from the Youth in Action panel again about the importance of recognizing how each group and each individual has a different journey. And I just see that as a big tension in how we continue to sort of address the needs of the groups that are most left behind and not fall into, again, the same pattern of scaling up a program in a one-size-fits-all manner without attention to then what other groups become the new marginalized or new groups that are not best addressed.
Okay, we'll have one last comment, and then because we're running short, we'll just go across the panel for kind of 1-minute closing remarks that deal with those issues. So thank you.
Thank you so much. I'm Natalia Kanem from UNFPA. Brilliant panel. Thanks to each of you for your interventions. My question is addressed to Jamie Madison Crane. I wanted to thank you for the song and also to acknowledge that you brought in this principle of non-linearity. So if you would just spend a few more minutes on how we can incorporate other methods of healing when we're talking about the whole adolescent person. Thank you.
Okay. So a few more, perhaps not, because I'll get CanWaCH on me, but 1 minute each to wrap up and sum up from what you've heard on the questions. Please, Jamie, starting with you.
I think my fellow lady panelists mentioned that when we look at services, we can't create a service that is for everybody. Because even when I look at Indigenous people around the world, or even in this country, we are very different in our own ways. We're very unique, and we have our own perspectives and worldviews. So when I look at the holism of a child or a holism of an adolescent, we have to take in every part of their being in order to be able to help move them, in order to help inspire them. And a part of that is to know who they are, to know their identity, to know where they come from, but also to help them understand how to balance themselves in today's society. And it gets very hard with everything that's going on in our society, with social media and whatnot. But I feel that we have to take a step back and look at our whole being. And like I mentioned, we have to look at our emotional self, our mental self, our physical self, and our spiritual self. And how are we creating programs that are speaking to each of those elements, so that we are holistically creating a program that is based on that child or based on the needs of the young woman or young girl.
Thank you. Jamie, Yadna, this tension between covering everybody and yet being specific to catch those who are left behind?
Yeah. So what we need to do is, instead of making plans for adolescent girls, thinking that this might be the best plan for them, we need to start talking more with the adolescent girls. What are their needs? And for the problem of scaling up, sometimes scaling up can have an impact of one size fits for all. But what we have to do is, when we're doing the scaling up in the different places with different population, we need to reach out and talk to the adolescent girls and their surrounding environment. What is the problem? What is actual need? And the program has to be like context specific, so that there is a scaling up, but still the programs will be appropriate to the context of the adolescent girls. So what we need to do is we need to talk more to the adolescent girls and reflect their voices in their program, and we need to talk more among us and strengthen the partnership so that we are not replicating each other program, but we are coordinating the best with the government and also within among us. Thank you.
Metisunge?
I think I'll just wrap up by stressing something I'm very passionate about in terms of we need to do more from community going up. The structures that are there, you'd find things will probably get easier. There are lots of community committees that have already been set up, and they're not working because they're not empowered, because our approach is from the top going up. So if there's this level here, level here, level here, level here, that by the time you get to the girl, she doesn't receive it. So I think going forward to the SDGs, we really need to think about approaching it from that aspect.
Thank you very much, and please give a round to the panelists. Thank you so much for your experiences.